Hello, everyone. My name is Maya Block-and-Gaibe. Nice to meet you all. Thank you so much for joining us in our Global Wash course, the spring 2026 7.5 week semester. We are really excited to have you in the course and looking forward to diving into some deep discussions about water sanitation and hygiene with you. But yeah, I'm just going to give you a short introduction to my background and to the course and introduce you as well to the rest of our teaching team as a quick just hello to the course. So again, this is me, Maya. You can call me Maya if you want to call me Dr. Block and Gaibe, that's also fine, but I'm fine with just Maya if you like. I have about 10 years of experience working in global health, primarily started in the Peace Corps when I was working there for about 2 years in Cameroon. I stayed another year after that year in Cameroon to work at the American School of Yaoundé as a chemistry teacher, and I also spent about 1 year in Uganda. So those are my main experiences working in global health abroad. But I have worked on projects mostly remotely on Nigeria, India, among other places. And I'm still gaining new experiences in global health, but looking forward to exchanging my limited knowledge of these different contexts and different settings around the world, and learning from you all and any experience that you might have as well in various settings and health. So I have my training in health behavior and health promotion. I did both that for both my MPH and PhD here at the College of Public Health at the University of Arizona. And I'm currently a postdoctoral research associate at the College of Architectural Planning and Landscape Architecture, also known as CAPLA. And I'm currently studying how green spaces impact health. So a big focus on climate change, environment, and related factors using kind of One Health sort of approach to learn about how our health is impacted. And we're using community-based participatory research method to research this topic. As well as teaching this class, I'm also teaching a section on global health this semester. A couple of you are involved in that section as well. So welcome to this class again with me if you are in that class, and looking forward to meeting many others as well who were not in that section. And I have taught another class on personal health and wellness as well. So really excited to be teaching this class with you all. I have a big passion for global health. Really enjoyed the work, especially since my Peace Corps experience really brought to light just made me really excited and engaged in global health work. I started doing some sexual and reproductive health work, and that's what got me involved in doing my MPH afterwards. So this is an example of one of the workshops that I did in sexual and reproductive health in Ebola, Cameroon. Um, and I also had the fortune to work on a WASH project at a high school where I was working as a science education volunteer. So I was teaching math and science at this high school. And they didn't have a toilet. They had pit toilets. They didn't have a toilet that had running water. They also did not have running water at all. So students would have to carry the water from a well to come and be able to have any drinking water. They also were not able to have a private place that was clean and sanitary for especially girls to be able to take care of themselves during their menstrual periods. And so many of them would skip school during that time. And so this was identified as a high priority for the school to make sure students could stay in school and be able to access be safe and healthy and everything at their school setting. And so this was a big learning curve for me. We applied for a kind of grant opportunity through the through the Peace Corps, and then also did some fundraising through a GoFundMe platform to get funds to be able to do this project and supply them with the toilet they're still using to this day. So that's my main experience in WASH. But otherwise, I have done other environmental health related projects like this project at the Public Health Research Institute of India, in Mysore, India. I visited them for about a week, but have mostly been working with them on different projects from afar, qualitative research on tobacco farmers and how their health is being impacted. And had the opportunity to be able to visit with them in the field and see how they do their community engaged research there. and exchanged knowledge with them too. And then, of course, I mentioned also that I did a year in Uganda for the Global Health Equity Scholars Program, learning a lot about clinical research and also health promotion in the field in Uganda from this amazing group of people at Makerere University Walter Reed Project. They also had gave me the opportunity to see their labs and learn more about how they were evaluating the quality of their labs, which involves a lot of assessment of sanitation and hygiene as well. I've accompanied them into the slums to where they were doing HIV prevention activities, providing PrEP and condoms and educational consultation as well. Um, Also volunteered on the side with a group of street boys, street children in Uganda while I was there in Kampala. Many of them just, yeah, on their own on the streets, and they would come together to do these programs that had been organized by this organization. And just had the fortune to also put together a program for them on WASH, especially on hygiene and why it's so important. And I gave them some soap as part of that project, and I heard afterwards that it was really impactful and that they even had kept the soap after I'd left, and were still using it even a week or two afterwards because they were using it so sparingly. Because that was a limited resource for them. They were yeah, so it was great to see them taking care of themselves, trying to, maintain their hygiene even though they were living with very little at that time. And finally, one more experience that I'd like to highlight. During my time in Uganda, I had the chance to work with this wonderful team again in the Uganda Cancer Institute at the Fred Hutch Cancer Center, where we were working on evaluating antibiotic delivery guidelines in this cancer center. And again, huge issues related to water, sanitation, and hygiene, hygiene in particular in this healthcare setting. It is a referral hospital for all of East Africa, so they have many, many patients coming through there, and it's mostly the more severe cases. So many people on chemotherapy who are immunocompromised. So antibiotic delivery, timely antibiotic delivery is especially important in these settings, and making sure that they also have practices that can avoid overcrowding so that people don't get infectious diseases while they're immunocompromised. But it's challenging in low resource settings. And so that was a reality that I learned about while I was there. Even in this high tech, like really well resourced facility, they were still struggling due to just overcrowding and a lot of need. So that's me in a nutshell. And I'm happy to talk about other experiences as well and learn also from you and your experiences during this course. So I'm looking forward to all of our discussion posts. Please do use that introduction post as an opportunity to be able to share more information about you. Apologies for the tickle in my throat. I know I'm just coughing right in your ear. But yeah, we'll just keep going. But yeah, sorry for that. Learning outcomes for this class, as you have seen as well in the introduction course survey, if you were able to complete that, include that. By the end of this class, hopefully you'll be able to describe the concept of health, discuss the global burden of disease due to lack of water, sanitation, and hygiene, discuss the challenges of achieving global wash, identify the social and economic impact due to inadequate water and sanitation for girls and women in particular, appraise the role of WASH as a primary intervention in infectious disease prevention and improving health. We'll also hopefully be able to evaluate the role and importance of technology and integration of behavior change into WASH programs and demonstrate conceptual and practical skills to implement a WASH program to improve health, especially through our midterm and final projects, and then identifying research gaps and needs to advance WASH and achieving sustainable development goals as they relate to WASH and global health as a whole. And I really have been enjoying going through the surveys that you all have been completing and seeing how you've been doing some thoughtful work on connecting your future career goals with these learning outcomes and identifying how you might be able to get something out of this class that will help you towards your future careers. I know many of you are getting close to graduation already. This is not a early course that people take early on in their undergraduate years typically. So please do use this as an opportunity to, share with me what you'd like to get from this course, and we'll do our best to be able to meet those needs. For the weekly schedule, as again you may have seen in the syllabus, we're going to start by posting content on Friday. So that's already tomorrow if you are watching this as I'm posting this today. So you'll be seeing week one material coming out pretty soon. And then we'll be starting. So this is still pre week one, right now on the 19th when I'm posting this video. And you'll start to see all the content and the discussion post being available. The quiz should also be available pretty soon too, so that you can be able to complete that once you've gone through all the content. But it would be due on Saturday. But if you'd like to complete it earlier, please feel free to do so. We don't want to take your weekend away from you, but since it is a 7.5 week course, we have a lot to pack in a short period of time, and I'm trying to give you enough space so you can be able to manage all of the different assignments, not having them stacked too much one on top of the other. But you will have some pretty tight deadlines, so make sure that you stay on top of it. Organize yourself so that you can be able to meet those deadlines in a timely way. Makeups are not going to be easy in this class since it is such a short time period and we have a lot to do. Um, so do review the most recent version of the syllabus. Some people have been pointing out to me some discrepancies between what was on D2L and what was on the syllabus. So I've tried to make sure that the syllabus was as up to date as possible. So if you downloaded it previously, make sure that you just double check that you have the most current version, and it will say last edited at the bottom. So make sure you have the last edited from March 18th. Assignments and grading. We have some different point distributions outlined here. You can see our introduction discussion post. For instance, that was one mistake that I had. It was listed as being due on the 19th, but it's due on the 20th or earlier than that, I think. But it's due on the 21st, so you still have a little bit of time to complete that. It's worth 20 points. I know that there is quite a lot in there, but it's mostly based off of completion. Read the rubric to make sure you get full points, but try to just address as many of those points as you can. Really, again, appreciate the time and thought that many of you are putting into that introduction survey and your introduction post. And to those of you who did complete the glass webinar, I hope that you took a screenshot of yourself at that webinar or have some other way of demonstrating that you were present there if you failed to do so. But we will be awarding additional points for extra credit if you did attend the webinar, but otherwise you'll review the glass report for that introduction discussion post. Moving forward, though, we'll be having some engaging discussion posts. The first one being this conceptual map or kind of visual notes about the content for this week. Looking forward to seeing what you come up with that. Please do post a picture of it and also refer using APA guidelines to at least three citations. And you can use the content that we're providing on D2L to refer to that. Preferably not too much to the slides, but if you need to use the slides as one of your references, you may do so and cite me as the author for that. Weekly responses to discussion posts are also both of them are the post and the response. The posts are due on Monday, and then your responses, two responses at least, are due on Fridays. You'll have six total, like that's confusing. So you'll have 12 total responses in a way because you'll have to do two responses each week, but it will be six for the six discussion posts. So 6 weeks worth of points that you'll receive for these responses, and they'll be due on Fridays. So you'll see that for these discussions, the due date will appear to be Monday, but it will be available until Friday. So after Friday, you won't be able to post anything else for that discussion post. So make sure you get everything in by Friday, but do try to get your discussion post in on Monday. Otherwise, you're going to be losing a point for that discussion post. Participation in weekly presentations and reading will be due on Saturdays. Um, but obviously you will need to complete those as well for your discussion posts. So maybe you'll be done with those sooner, but we will be monitoring to see if you have completed these the full content, all of the content and reading and videos and everything, as we can view that what you've seen on D2L. So make sure you do open and interact with the content on D2L that we provide. We may use a platform called Feedback Fruits for some of the reading, and that also gives us more information and gives you the chance to also annotate documents and provide feedback, just like add some comments about the reading. For those of you who are in my global health course, you're familiar with the platform. But it's a great opportunity to be able to Just interact with each other as you're reading and provide some notes, and that will be part of your participation grade for that document. It's not there for week one, but you will probably see it come in for week two. So quizzes will also be there for 4 weeks. You don't have a final exam. You'll have a midterm and final midterm project and a final presentation instead, but the quizzes will be just on the content that will be for those weeks, and each of them will cover about 2 weeks. So the first quiz will cover pre-week one and week one material. Pre-week one material will include the syllabus, all of those terms that we've asked you to define, and some other information there too. So midterm project is described in the syllabus, but you'll see it as being focused on developing a proposal for a real, actual funding opportunity that you could apply for if you are interested. And it will be asking for you to complete a certain amount of information as if you were applying for a proposal. It will be graded on completion of those tasks as asked for in the assignment description. Um, in the final presentation, however, you must fine tune it based off of feedback received on the midterm and present it in a PowerPoint presentation using a Zoom recording, post the recording, not a link to the recording, the actual MP4 file, and we'll be grading you on quality of your work in the final presentation, as well as completion of a few additional features like an evaluation plan. If you have any questions about these, it's never too early to reach out and start working on these projects. But it's hopefully going to give you a chance to really practice and apply a lot of the skills that you'll be learning during this course. And then you'll see here our weekly schedule. My video is kind of covering everything here, but you'll see week one material. Pre-week one again covers the syllabus, the introduction post, and your survey. You will be tested on this, so please do review it. There is no syllabus quiz, so apologies for this mistake on that. I will remove that from the syllabus. It does appear I still have failed to remove that. But you will have an introductory survey and introductory posts that are due this week. You'll have on Friday all of the week one material available to you, and then we'll be covering kind of the history of WASH, some of these key moments in history that led to WASH priority development and what it is today. You'll also see in week two, we're going to be talking about WASH and waterborne diseases, getting into some of these specific kinds of diseases that are impacted by water sanitation and hygiene. Global issues in WASH will be week three, where we're going to talk about a couple of key issues in global health that also are related to WASH, like gender, nutrition, HIV. And then for week four, we're going to be getting into some information about the strategies for WASH, especially in programming. So talking about behavior change and how we can be able to do promotion, health promotion, through community and school programming in particular. We'll talk also in week five about other interventions that are more based off of infrastructure and technology, these more like harder interventions that can be able to improve access to WASH, and how we engage the private sector as well. So we'll talk a little bit about the multidisciplinary nature of WASH in this chapter, in this week. Week six, we'll be talking about research gaps and barriers. So we'll talk a little bit about evaluation methods in this time and other ways of being able to evaluate WASH and quantify it. And we'll be actually talking about the global burden of disease in week two as well. So we'll get a little bit into how we quantify WASH that in week two, but week six we'll get into it a little bit deeper. And then week seven we have technology and innovation in WASH. So we'll talk a little bit about the different types of like innovations that we can use to be able to address WASH. We'll talk a little bit about AI, for instance, as a quickly evolving tool, and how it might interact with water sanitation and hygiene, as one example. So here is a quick summary of our teaching team. We have our teaching assistant, Neela. She's a PhD student here at MESCOF, supported by a Fulbright scholarship. She earned her master's of public health and health policy and management from the School of Public Health at Georgia State University in 2014. She is from Indonesia, and she returned to Indonesia after that, joining Universitas Pahlawan to Tuanku Tambusai, a private university where she is lecturing in community nursing and public health and established an Indonesian diabetes center. Her research focuses on diabetes mellitus, especially type 2 diabetes prevention and management, with an emphasis on behavioral science, lifestyle factors, and adolescent health. She initiated the establishment of a diabetes aware village in Indonesia, working with youth and health cadres as diabetes ambassadors. So you can CC her on any email sent about the course to make sure that you get a timely response, and make sure every time you write to us about the course, you include the title HPS 409. And that's her email there at the bottom. And then finally, we have our preceptor as well, Sanbi Lamba. She has experience in public health and clinical settings, community service, leadership. She's an undergraduate student here, graduating this May at MESCOF, and she is pursuing a Bachelor of Science in Public Health with a focus in physiology and medical sciences, and minors in Spanish and honors health and human values. She currently serves as Secretary General of the Arizona Model United Nations, President of Administrative Affairs for the Flying Samaritans, and a support group facilitator with Tunidito Children and Family Services. In these roles, she contributes to international diplomacy, leads public health and medical service trips in Mexico, and supports children and families coping with grief. She is passionate about advancing health equity, providing compassionate care, and building cross-cultural understanding. And so you may CC her on emails, especially those that are not sensitive or personal. She'll be aiding with some of the logistics on D2L, but she will not be grading any assignments. So if you have any questions about grades, just send it to me and Neela. But in summary, we're looking forward to a really great semester. This is my email address. It's also included online on the D2L site, as well as my booking link. So please feel free to send up book a time with me at any point in time if you want to just check in with me on a Zoom call or a Teams meeting. Happy to do so. But otherwise, we do try to respond in a timely manner to emails. So I'm looking forward to this and getting to know you all pretty soon. Have a great one and feel free to reach out at any point in time if you have any questions.